But those cases are especially resistant to treatment of tinea versicolor because they're not tinea versicolor. They're actually lymphoma of the skin. Hi, I'm Dr. Yuval Bibi. I'm a board-certified dermatologist. And I wanted to talk to you about the issue of white patches on the trunk, on the back, on the chest, sometimes extending to the arms. Now, this could be a problem that could be caused by multiple conditions, and I wanted to discuss a few of those conditions that can lead to white areas that appear on the trunk and sometimes on the arms. Now, the most common condition that does that is what we call tinea versicolor or pityriasis versicolor, and that is, in the best way to describe that, is that this is a yeast overgrowth on the skin. The yeast, which is called Malassezia forfor or Pityrosporum, can grow in greater numbers on certain people's skin. This yeast is found on everyone's skin. It's part of the normal microbiome, apparently, for the most part. And when this yeast overgrows on certain people's skin, for various reasons, it will form areas that don't tan as well as other areas, because of the yeast's ability to bleach out the skin and prevent tan. So those areas are going to look like areas that are lighter than the surrounding skin. They often have scale on them and they look oval in shape, meaning ellipse in shape. And those can converge into each other, so they can look like large areas of oval areas that converge into each other with scale on them when it's very widespread. And this can be quite disfiguring. It can look pretty bad on the skin, and people don't like it because they don't look even. So they come to us and we get them treated. Though the treatment for tinea versicolor is anti-yeast or antifungal medications, certain over-the-counter preparations like zinc parathion shampoos or selenium sulfite shampoos work pretty well for this condition. You just need to apply them in the shower, leave them on for about a minute or two, then rinse them off, and the treatment takes a few weeks to make things go away in the way of getting rid of the excess yeast. Tanning takes a little bit longer once you get rid of the excess yeast, and then you need to basically tan the area out and make sure that you regain the color over these areas, and that's a matter of getting some sun exposure, obviously not too much. Now, in certain severe cases, do require prescription antifungal medications, like ketoconazole 2% shampoo. The 1% is available over the counter, or prescriptions like cyclopirox shampoo or cream. And in certain cases where the overgrowth is very severe, you may actually be required to take systemic antifungals, medications such as fluconazole or ketoconazole, which you'll be taking briefly to get rid of that extra yeast. So this condition is treatable and curable. It may recur in certain people because they are prone to it, probably by means of genetics, but this condition is easy to treat. There are other conditions that look like tinea versicolor, such as, for instance, post-inflammatory hypopigmentation. Hypopigmentation, or lighter coloration of the skin, can appear after the skin has been inflamed. Over a certain area, the inflammation goes away, and it discolors the skin in its wake, meaning it leads to the skin being unevenly colored. In certain cases, inflammation can lead to hyperpigmentation, meaning darker areas on the skin, and in certain areas or certain cases, it can lead to lighter coloration on the skin. Now, those cases are not going to respond to antifungal treatment at all. They may require some sun exposure. Obviously, they will require calming down or treating the inflammation on the skin to make sure that it does not affect those areas and undo your work with sun exposure. But overall, what needs to happen is control of the inflammation, if it's eczema or other types of inflammatory conditions, and then you need to follow up with sun exposure, careful measured sun exposure, to get some of the color back. Vitiligo, otherwise known as Michael Jackson disease, because the late singer Michael Jackson had an extensive case of it, is a condition that's an autoimmune condition that targets melanocytes, which are the cells in the skin that make the pigment that are responsible for the color of the skin. Whether it's lighter or darker, melanocytes are responsible for that. And vitiligo targets those cells by means of the immune system, destroys those cells, and leads to loss of pigment or color over the areas that are targeted. Now, those patches can look very, very different from tinea versicolor or post-inflammatory hypopigmentation. They are decidedly white, and when you visit your dermatologist to make the diagnosis, the dermatologist might use something called a Woods lamp, which is a special fluorescent type of lamp that you can shine on areas of the skin and expect what we call a depigmented response, which means the area is enhanced, the whiteness of the area is enhanced under that fluorescent type of light bulb, and the area appears very distinct from what you would see under the circumstances of tinea versicolor or post-inflammatory hypopigmentation. It would actually shine bright and would be distinctly consistent with vitiligo. Now, vitiligo can be treated in many cases, can be treated with topical medications such as topical steroids. There are other topical medications that can be greatly helpful for vitiligo, such as topical calcineurin inhibitors or topical JAK inhibitors. And in certain cases, vitiligo needs to be treated with more broad techniques like light treatment, for example. So narrowband UVB can help treat vitiligo in certain cases where it's very, very widespread, and in certain cases where the vitiligo is either too widespread or too resistant to topical medication. Certain systemic medications can be employed, like JAK inhibitors and other medications as well. Vitiligo can be concealed while you're dealing with your vitiligo, especially if it's on the face or highly noticeable areas. And the way to deal with that is to conceal it. There are concealers out there that you can get at the stores, at the cosmetic stores, that are matching specific skin tones or color. And you can get them to match your specific skin color and apply that concealer over the affected area to mask it completely and make it completely unnoticeable to anyone who doesn't know any better. They're not going to notice the difference. Now, vitiligo responds to treatment in a very distinct way. When we see vitiligo respond, the way it responds is you start seeing islets of pigment appearing in the middle of those white areas, meaning the pigment comes back over certain areas in the center, in the middle of those white patches or white areas. And those areas converge over time to fill in that area that was previously depigmented or lost its color and color it back to normal. That takes anywhere from a few weeks to a few months, sometimes even years with the more resistant cases, but that would be the sign you want to pay attention to make sure that you are actually responding to your medication if you have vitiligo. The last condition on the list is actually quite a serious condition, and this is a type of lymphoma called hypopigmented mycosis fungoides, which is a type of T-cell lymphoma of the skin. Now, in those cases, what you see are areas that look quite like tinea versicolor. They can look like thin, scaly plaques on the skin, on the trunk, sometimes affecting the arms and the legs. In those cases, can look like tinea versicolor. They can be oval-shaped, thin, scaly plaques. So a lot of the times, these people go unnoticed and undiagnosed, treating tinea versicolor for a while, trying different treatments, moving from one treatment to the next, assuming that they might have cleared some of the areas because the scale may go down coincidentally with the treatment. But those cases are especially resistant to treatment of tinea versicolor because they're not tinea versicolor. They're actually lymphoma of the skin. Now, these cases need to be diagnosed, and the way you diagnose those cases is you get a skin biopsy. It's a very simple procedure, takes a few minutes at the office. Now, cutaneous T-cell lymphoma can be treated topically with certain medications and can be treated by light treatment. And in certain cases where it's very severe, systemic medications are necessary, and it does require pretty frequent follow-up with your dermatologist in certain cases where the lymphoma is very widespread or extended to other parts of the body. You may be following up with an oncologist because those cases can be pretty serious. But if you have a case of tinea versicolor that doesn't seem to be responding to anything and is consistently resistant to medication, maybe consider getting a skin biopsy to differentiate between your condition and what's called cutaneous T-cell lymphoma, which is a rare condition but may be possible in certain cases. If you found this video helpful, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Thanks for watching. God bless.